An interesting discussion this morning, and our side is going to expedite a little bit the morning's process, partly because Senator Coburn is also in the defense authorization markup that Senator McCain is in, and has seen what happens with a number of his amendments. I want to make just a couple of comments on the bill and a couple of comments on some of the amendments that could have been offered, and then we can have Senator McCain come in and present his amendment, I guess. Now, I want to thank Senator Sanders for his comments, but I do need to point out that the criminal charges and settlements that he described involved Medicare and Medicaid, both of which are government-run plans. And perhaps the problem is with government-run plans and their underinvestment in administrative controls and distortions that are caused by their price controls. And I'd also like to point out that all of those cases that were mentioned were ones that were prosecuted and won during the Bush administration. So there has been some oversight and some activity there. The difficulty with the fraud and abuse section that this bill has is that it drastically increases the cost of health care for large employers. The bill imposes new restrictions in the name of combating fraud, but it's a clear attempt to limit the ability of employers to offer uniform benefit packages across the country. That reduces administration costs. You eliminate that, you increase the administration cost, you increase the cost of health insurance. If these changes are enacted, employers may not be able to provide comprehensive targeted plans for their employees. Now, the authors of the bill say they would like to focus on fraud and abuse in the private sector, not the public sector. That seems to be a theme throughout the bill. The prevention section requires the Center for Disease Control and Prevention to evaluate employer wellness plans with federal dollars, and now they want to combat fraud in the private sector with federal dollars. Here's an idea I'd like to throw out. Let's concentrate on combating fraud in the government-run programs before we spend taxpayers' dollars on saving money in the private sector. Those cases that were won were government-run. We could be saving the government over $8 billion in fraud if we targeted the public sector. I didn't interrupt while you were speaking.
Sorry.
Public sector, but instead we're going to spend money on combating it outside the federal government. Now, also included in this bill before us are provisions relating to false claims. It states that any employer or insurer that makes false claims will be penalized, and such claims may be under the jurisdiction of the Department of Justice. So what this section will lead to is one thing, and one thing only, and that will be more frivolous lawsuits. We've already seen that there's no desire to do anything in the medical liability area, that we're going to shift that off to the Judiciary Committee, and the Judiciary Committee probably won't handle it. So if we really want to combat fraud, we should strike that section and insert a sense of Congress that will fund fraud and abuse activities at the Centers for Medicare and Medicaid Services, and that's where we find the real fraud and therefore the real savings. A number of states have done that in the Medicaid area and have made real advances. In fact, I just talked to a man that moved from Wyoming to Utah to handle that situation for them, and talked to me about what could be done in the Medicare areas, not just the Medicaid areas. And finally, the bill before us establishes a senior advisor to the Secretary of Health and Human Services and another senior advisor to the Attorney General. The Kennedy-DODD bill does not, it creates more bureaucracy. Health and Human Services and the Department of Justice don't need advice on how to combat fraud. They need resources to combat fraud in the government programs. The bill creates another council to discuss issues relating to fraud. Again, these departments don't need to further discuss fraud and abuse. They need the resources to combat it. And there isn't anything in this bill that will actually reduce fraud. Combating fraud should be a bipartisan issue, and I think our side has raised some amendments, but we know that they're not going to be included in it. Senator Coburn has, I think he had 9, but there are 6 that he's particularly interested in. To reduce Medicare fraud, And I could never do an adequate job of discussing these and won't even attempt to, but he points out that the STOP Act is a more effective way to prevent fraud and abuse. All of his amendments are aimed at the Medicaid and the Medicare fraud, and we know from state experiments which deal with Medicaid, because that's the one that they have to pay a portion of and they're extremely interested in, that there are some huge opportunities there. He even suggests a doc fraud squad, which would be a demonstration program where there would be healthcare professionals that would conduct random visits to healthcare practices and attempt to purchase pharmaceuticals illegally, purchase medical equipment, participate in hospital visits. The Inspector General then would be required to follow up on any notable findings and refer individuals to appropriate state and or federal authorities. And of course, health courts comes up again. State health courts, state medical liability situation. Senator Gregg has some much more technical amendments that he would offer, but would just ask you to look at, because the Kennedy bill would open up the current preemption of state fraud laws for plans under ERISA, and it allows the plans to be subject to 50 different state laws on fraud. And his amendment would strike that provision and maintain the current law. That's one of those things, again, where we'd be making it extremely difficult for employers to comply if they have employees in most of the states. Another one of his amendments gives the Department, the Kennedy bill gives the Department of Labor the authority to take summary cease or seizure action on plans in a financially hazardous condition. And his amendment would strike that, and that way the Department of Labor wouldn't have the authority for cease or seizure action on health insurance plans, because that shuts them down and eliminates some of the service that might come to the people, instead of some kind of a mechanism for making sure that the people will continue to be covered. All of his amendments deal with the ERISA, particularly the cease or seizure parts of it. I hope that the other side will take a look at those and see if there isn't, as I mentioned, there's at the least a glimmer of an idea in these that have some basis for need and hopefully could have something done. He expands the ERISA cease or seizure again in his amendment number 34. And then Senator Hatch has an amendment number 28, which is just a study to determine the need for separate health care fraud offices within HHS and Department of Justice. But none of those will be offered this morning. But I would ask you to take a look at them, see if there's some value in them, some way that they can be used, and some way that we can switch from placing this emphasis on the ERISA companies that operate over a variety of states, so that we're not making their health care more expensive and more administrative oriented rather than health care oriented. And I thank the chair, and I think that leads us to the McCain amendment.
Yeah, if I could, I appreciate that very much, Mr. Enzi. As I understand it here, these are, we'll obviously have staff take a look at these proposals. And as I said earlier in the week, when the issue was raised by, I think it was Senator Coburn raised the issue, I wanted to proceed by doing title by title of this legislation, so we'd have a manageable way in which to proceed. And while we still have remaining, obviously, to deal with the long-term care issues because of the scoring problems, and we still, of course, have Title I to come back to as well, that those matters will be left open until the following week, after the week we come back from Independence Day recess. But I also made it clear that I wasn't going to be so insistent upon that closing out titles that I wouldn't consider, because of circumstances, to handle matters when they come up, and I intend to live by that promise as well. But I would ask colleagues again, and I respect the fact that we all have conflicting obligations around here, as evidenced by several of our colleagues that are off doing other things this morning as well as trying to be here. And again, I'm very grateful for the attendance we've had on this matter over the last 2 weeks. And with another week to go when we get back, will be critically important. So I understand why they can't be here. I understand the intent, and you have my commitment and the staff's commitment. They'll go over these amendments and see if there isn't something that can be done to accommodate. I would like to just mention, if I could, regarding the fraud and abuse section, and that is the majority of the amendments filed to this title make policy or add new authority to Medicare and Medicaid. And while we clearly are stepping on each other's jurisdictions, and we've been over that point earlier, an awful lot of this is more appropriately the jurisdiction of the Finance Committee. That's not to say we can't be heard on it, obviously, but I think most of my colleagues are aware of that. And so there's no question about the importance of dealing with fraud and abuse and public programs as well. And I don't think it's our intention. I'll let Senator Sanders, I know, wanted to intervene.
Just very briefly, thank you. Just very, I wanted to respond to my friend, Mr. Enzi. You know, I get tired, and I think the American people do, about hearing the word Medicare fraud, because the implication is that we have people who work for Medicare, work for the government, who are dishonest. Now, we've done a little research. It's not definitive. I am not aware of major examples where people who work for Medicare, who work for the government, have been dishonest, have been on the take, have been bribed. There may be. I haven't seen it. When we talk about Medicare fraud, what we're really talking about is pharmaceutical industry fraud against Medicare, insurance company fraud against Medicare, private hospital insurance fraud against Medicare. And my hope is that when we refer to fraud with Medicare and Medicaid, we put our finger who is committing the fraud. It's not Medicare. And I would hope we rephrase our language in that regard.
I think it's Medicare and Medicaid, though, that have the obligation to be doing the enforcement of it.
That's fair enough. But we don't, and we can make that better. But when, for example, if somebody doesn't pay their taxes and they go to jail or they don't get a government job, we don't say it's the IRS fraud. We say, you didn't pay your taxes. Let's put our finger on the people who are responsible for the fraud. We can argue, and I agree with you, we want to do a better job, and I think that's what this bill is trying to do, to combat fraud. But the people who are committing the fraud is not Medicare and Medicaid, it is private corporate interests.
That's the point. Trying to quantify this is not easy, but just to briefly share with my colleagues is how much fraud is out there. In the 1990s, the FBI estimated that 10% of all health spending was lost to fraud and abuse. That's an FBI conclusion. The National Healthcare Anti-Fraud Association estimates that 3% of all health spending is lost to fraud and abuse. So whether it's 3% or 10%, presumably somewhere in there, but it's a significant amount. Some suggest that fraud and abuse is only a problem in the public sector. And Senator Sanders has, I think, answered that. Clearly, looking at how well these programs are managed is very important. But I think your analogy as well, to kind of use this as a suggestion that that's where the fraud and abuse, the bulk of it is occurring, I think is to misplace. The Department of Labor's Employee Benefits Security Administration is a key enforcement agent. And as of May of 2009, a month ago, they initiated 768 and 207 criminal investigations, obtaining monetary penalties of more than $205 million. They currently have 73 civil and 60 criminal investigations that are ongoing. Criminal activities, often organized crime operations, result in employers and individuals losing millions. Organized crime is not employees of Medicare or Medicaid. These are people who are taking advantage of the system and scamming it at the disadvantage of the people who count on these programs. So the criminal divisions, to the extent I'm aware, now there may be exceptions to this, and if there are, it's important for us to know it, are investigating employees of the Department of Health and Human Services or of the Medicare program itself. I suspect that most of these cases are focusing on non-governmental employees, the people who are abusing the process. That's where the bulk of it is. I see my friend from Arizona is here, and I promised him we've reached a point here, John, where I will stop here. I was just kind of filling in.
Mr. Chairman, I know you, I don't want to interrupt the flow here, but I do want to respond to Senator Enzi's arguments, if we can do that. I don't know if you have.
Would you?
Senator McCain.
Could I say to my colleague, I apologize. I'm in the middle of the markup of the defense authorization bill down below, and I want to apologize to all members. But we're trying to wrap this up, obviously, today, as the chairman's trying to wrap it up, and so I appreciate your indulgence.
Sure.
And I thank you, and I thank the chairman for your courtesy. This is a simple amendment. It's one issue that's been banging around for years, and one that, no matter what happens today, we will win sooner or later because it's in the interest of the American people. And if the amendment could be handed out, I'd appreciate it.
I assume this is the one on the
McCain number 4.
It is the one on drug importation.
Yes. One of my favorite subjects.
Of course, normally when this comes